Now, in the last year of living under the Covid-19 pandemic, many citizens suffering from kidney illnesses are forced to put their hopes for a transplant on ice. But with the dark days slowly subsiding, one patient, Margaret Muthoni, finally received a kidney transplant after 1 year of waiting, and from a donor that puts meaning to the saying that blood is thicker than water. Gina Kiroi has more.
The sights and sounds of medical staff gathered here today to join one man and one woman through a kidney transplant, an operation that has been suspended several times over the past 1 year. Each movement intentional and thorough to ensure the success of the surgery set to take place in the next few minutes. Each rise in the heartbeat closely being monitored, serving as a reminder of the fine line between life and death. As the team suits up to conduct the kidney transplant surgery, we speak to the recipient, Margaret Muthoni, who is in the room just adjacent to the donors.
Kwa maana nilikuwa nifanyiwe transplant last year May, sasa ikakuwa tu haiwezekani. By then sikuwa nimeanza kufanya dialysis, so by September ikakuwa sasa lazima nianze dialysis as we plan for maybe to come, the transplant to come later. So it has not been easy.
Okay, and who is giving you the kidney transplant?
My brother, yeah.
And how are you feeling about your brother being able to?
I'm just happy. He's my hero. He's my hero. Yeah, we are 6 of us. And when I requested them, the siblings, he was the first one to volunteer.
As a nurse, Muthoni went from treating patients to being in dire need of dialysis during the pandemic, a process she, just like many Kenyans, says was draining both physically and financially.
I have to take off from job at least 2 days in a week just to go for the dialysis. Then the cost, at least currently NHIF is working for us, but there was a time where I was dialyzing, they were on strike. So I had to go to a private. Each session, we were paying 9,500. So you see, like in a week, you need to spend at least 20,000.
As Muthoni's brother goes under the knife, the bed on which the kidney will be placed in is prepared by another team of doctors.
When they have removed it, we wash it, we put it in ice and cool it quickly because we have removed it from its blood supply. We wash all the blood from the donor, from the kidney, and then we come and put it in the patient who is receiving it, in the recipient patient.
Doctors agree that the pandemic fractured many kidney transplant operations due to the uncertainty of the new normal.
It was very difficult because of the many restrictions of movement and also the concerns that anyone, including the patients or the relative or the donor, could be COVID positive.
But for Muthoni, waking up to the possibility of good health is not the only thing that excites her about her future, as her brother is on her mind minutes before she undergoes the surgery.
When he wakes up, I just feel like I want to hug him. And before we came in, I told him God to bless him as we prayed together. And I'm very happy about it. Yeah. And my family also, my entire family has been very supportive.
For Muthoni, this may be a happy ending after months of toiling with the lack of a kidney transplant due to the COVID-19 situation, presenting hope for thousands of other patients who may be in a similar situation. Gina Kiroi, NTV.